Assalamualaikum and good day. My name is Izzati Wafika binti Kamilan. The title of my final year project is Formulation of Moringa aloe vera polyvinyl alcohol PVA hydrogel with antibacterial properties. In this presentation, I will discuss the background, objective, methodology, result, discussion and conclusion of my study. Skin and soft tissue infections, are also known as SSTI, are among the most common bacterial infections worldwide and affect people of all ages. According to World Health Organization, antimicrobial resistance is increasing globally, with 1 in 6 bacterial infections now resistant to treatment. This poses a serious threat to modern medicine. Skin infections usually occur when bacteria contaminate open wounds. Staphylococcus aureus is a major cause of skin infections, while Escherichia coli is often associated with wound contamination. One such natural product is Moringa aloe vera, which has been reported to possess antibacterial and wound healing properties. Moringa aloe vera is a fast-growing plant that is widely used in traditional medicine. It contains various bioactive compounds such as flavonoids, phenolics, and alkaloids, which are known for their antimicrobial and antioxidant activities. Previous studies have reported that Moringa aloe vera exhibits antibacterial activity and promotes wound healing, making it a suitable natural agent for biomedical applications. Therefore, Moringa aloe vera was selected in this study as the antibacterial component to be incorporated into the hydrogel. Polyvinyl alcohol or PVA is a synthetic polymer that is biocompatible, non-toxic and safe for biomedical use. PVA hydrogel are able to maintain a moist wound environment, which is important for faster wound healing. The freeze-thaw methods allow hydrogel formation without chemical cross-linkers, reducing potential toxicity. In addition, PVA hydrogel can act as carriers for bioactive compounds such as plant extracts, making them suitable for antibacterial wound dressing applications. The objectives of this study are: first, to formulate a polyvinyl alcohol hydrogel incorporated with Moringa aloe vera extract. Second is to evaluate the antibacterial activity of the Moringa aloe vera PVA hydrogel against Staphylococcus aureus and Escherichia coli. The methodology of this study consists of 2 main parts. First is the formulation of the PVA hydrogel incorporated with Moringa aloe vera extract using the freeze chill method. Second is the evaluation of antibacterial activity using the distribution method against Staphylococcus aureus and Escherichia coli. These methods were selected to assess both physical formation and antibacterial performance of the hydrogel. The hydrogel was successfully formulated using the freeze chill method. Both the blank hydrogel and the hydrogel containing Moringa aloe vera extract show a smooth and flexible structure. No visible cracks or surface separation were observed, indicating successful hydrogel formation. Incorporation of Moringa aloe vera extract did not affect the physical integrity of the hydrogel. Then, gram staining was performed to confirm the identity of the bacterial cultures. S. aureus appear purple in color, with cocci arranged in cluster, confirming it as a gram-positive bacterium. Meanwhile, E. coli appear pink or red in color, with rod-shaped cells, confirming it as a gram-negative bacterium. This result verified that the bacterial culture used were appropriate for antibacterial testing. The antibacterial activity of the hydrogel was evaluated using the diffusion method. The hydrogel showed antibacterial activity against S. aureus. However, no inhibition zone were observed against E. coli for all extract concentration. This indicates that the hydrogel was effective against gram-positive bacteria, but not gram-negative bacteria under the tested conditions. The successful formation of the PVA hydrogel using the freeze chill method indicates effective physical cross-linking without the need for chemical cross-linkers. This approach is particularly suitable for biomedical application as it minimizes potential toxicity and improves biocompatibility. Smooth and flexible morphology observed suggests that uniform polymer network was formed, which is essential for wound dressing materials that must adapt to skin movement. The incorporation of Moringa aloe vera extract did not negatively affect the hydrogel structure, indicating good compatibility between the extract and the PVA matrix. Similar findings have been reported in previous studies where natural plant extract was successfully incorporated into PVA-based hydrogels without compromising physical integrity. As I said in the previous slide, gram staining was performed to confirm the identity of the bacteria strain and to support interpretation of the antibacterial result. The clear differentiation between gram-positive SRS and gram-negative E. coli highlight importance of bacterial cell wall structure in determining susceptibility to antibacterial agents. Gram-positive bacteria has a thick peptidoglycan layer but lack an outer membrane, making them generally more susceptible to antibacterial compounds. In contrast, gram-negative bacteria have an additional outer membrane that restrict the penetration of many antimicrobial agents. Therefore, confirmation of gram characteristics strengthen the reliability of the antibacterial findings observed in this study. The diffusion assay demonstrated selective antibacterial activity of the Moringa oleifera incorporated hydrogel against S. aureus, while no inhibition zone was observed against E. coli. This selective activity can be attributed to structural differences between gram-positive and gram-negative bacteria. The outer membrane of E. coli acts as a permeability barrier, limiting the diffusion of antibacterial compounds. It is including plant-derived bioactive molecules. Additionally, the diffusion methods depends on the release and diffusion of active compounds through the agar medium. Limited diffusion of Moringa oleifera compounds from the hydrogel matrix may have further reduced observable inhibition zone. Methodological factors such as displacement may also influence diffusion efficiency and antibacterial outcomes. These findings suggest that while the hydrogel formulation is promising, further optimization is required to enhance compound release and improve antibacterial performance, particularly against gram-negative bacteria. To conclude, this study successfully formulated a PVA-based hydrogel patch containing Moringa oleifera extract using the freeze-thaw method. The hydrogel demonstrated suitable physical characteristics for antibacterial patch application. The antibacterial test showed that the hydrogel exhibited inhibitory activity against Staphylococcus aureus, indicating effectiveness against gram-positive bacteria. However, no antibacterial activity was observed against Escherichia coli, likely due to the protective outer membrane of gram-negative bacteria that limits antibacterial penetration. Overall, the findings suggest that the Moringa oleifera hydrogel has selective antibacterial activity, particularly against Staphylococcus aureus. As for the recommendations, for further studies, more repetitions are recommended to reduce experimental error. In addition, antibacterial testing methods such as MIC or MBC assay should be used to obtain more accurate results. Modification of the hydrogel formulation or incorporation of permeation enhancers may also improve antibacterial effectiveness, especially against gram-negative bacteria. So, this is the references I used for the presentation. That's all from me. Thank you for your time and attention.